Hi, everybody. Welcome to Pivot and Profit with Priscilla. Today, I want to talk to you about how you're going to grow your home healthcare agency. I have a pediatric home healthcare agency. Prior to owning this agency, I had a senior home healthcare agency. My pediatric home healthcare agency has grossed more than $1 million just in the past year, and we've been operating for 5 years now. What I want to be transparent about is I haven't grown my business this year. I chose to stop growth in my business because of my cancer diagnosis. So we just sustained our business with the number of clients that we currently have. Now that I'm in remission, the cancer's gone, I'm ready to get back in my growth phase. And since I know how to do this because I've done it before, I want to share with you guys the tips and tricks that I've used in the past that have helped me that I'm now going to be using once again. So let's start with building relationships. People often tell you to network. They often tell you to get to know people and build relationships with people, but they sometimes don't tell you where to go for things like that. When it comes to home health care, you're going to go to some of the typical places where sick children would be or sick people would be. A hospital. That's one of the first places you're going to go. But when you go in there, you're going to look for discharge planners. Okay? You're going to look for support staff, social workers, people like that you're going to want to get to know. You can also find these people on websites, things like that. But these are the type of people you want to connect with. You want to let them know that, hey, I have home health care services. I can service your patients when they're coming out of the hospital, because that's when you want to capture the client. When they're in the hospital, they're getting their diagnosis and they're about to get discharged. Another place that you can find clients are hospice facilities. A lot of hospice services now are done in home. They used to be done inside of those facilities, but most of my clients that receive hospice services, those services are performed in the home. The Medicaid side of home health care will allow you to provide home health care services alongside hospice services. However, the only services you can provide are skilled nursing services with an LPN or an RN. The hospice service will provide the unskilled services with the CNA or PCA.
Okay, so whenever I hear networking, I'm always like, is it kind of awkward? Like, am I just walking into a hospital looking, hey, I'm looking for discharge planners and support staff. Where do I find your social workers? Like, walk me through how I go about this. Am I just walking into the hospital and looking for these people? Or is there like a process? Is there a group that they're in? Help me.
Good question, Anna. For me, I'm not just walking in the hospital asking for anything, especially nowadays. I like to do my research online first. I am very aware that a lot of people reach out and respond better via email. LinkedIn is a good resource to find people in certain types of professions. I think LinkedIn is a very good resource to look up a hospital or people that work in the hospitals and those type of support staff positions. Also, when you do get a client, you're going to automatically be connected with their doctor. And if they're coming straight out of the hospital, you're going to be connected with the discharge planner or the head nurse or the support staff, the support services. Keep those connections. Keep those connections with those people. Keep their names. Check in with them often, because there are a lot of times that they have other clients that are about to be discharged, and the parents look to them for information on home health care services. They will often ask the planners, hey, do you have an agency you could recommend? And you want to be that agency. So whenever you get the name or a number of the support staff in these hospitals, it's like gold. You keep it and you constantly keep that connection and you check in with them. The next thing you want to do is you want to be reliable for hard to place clients. Hard to place clients could be clients with significant health issues. Even though they don't seem like they're hard to place, clients with trachs and vents, sometimes there are not a lot of nurses that understand how to handle trachs or even want to deal with trach patients. So those can sometimes be difficult clients to place. The most difficult clients to place are going to be those clients that live in remote areas, the clients that live far away. I live in Metro Atlanta. There's clients all around Metro Atlanta. North, south, east, west, they're all within the proximity of Metro Atlanta. But once you get out of the city and you start heading towards Social Circle, Georgia, or you head south toward Columbus, Georgia, it becomes more difficult for these discharge planners and the support staff to help parents find services. Many of my clients are outside of the limits of Atlanta. And the reason that can be difficult is because it's hard to find nurses that want to travel that far. Most nurses are centrally located near hospitals and near metro areas. However, I never shy away from taking a client that's out in a remote area. My practice is I target my search. I target my hiring search on Indeed. I target it to that specific area. I target LPNs, RNs within that specific radius. And I hire them specifically to take care of that client. You don't want to hire a nurse that's going to have to drive an hour or an hour and a half to get to a client. That's not sustainable. They won't last long. You're going to tire them out. So I typically hire nurses that are within a certain amount of radius. I try to get within 10 miles, but if I got to go out to, especially if you're in a remote area, 10, 15, 20, maybe 20 miles in a remote area is definitely not as bad as being 10 miles and you're in Metro Atlanta and you have to travel through traffic. So don't shy away from servicing those clients. Whenever a discharge planner or a social worker calls me about a client, it's always yes. I will figure out how to get that client care. I keep information for remote nurses and nurses that are always looking for work.
So I guess my question is, it sounds like there's an opportunity for somebody to start a home healthcare agency for just rural areas. Like, is that something that you would recommend, or is it just not enough patients for that to sustain a business?
I don't know if there are a ton of patients in rural areas, so I wouldn't say start an agency specific to rural areas. You always want to include metro major city areas. These are where the bulk of hospitals are going to be. These are where the bulk of your clients are going to come from. However, you don't want to ever exclude rural areas. So you always want to be accessible to those clients that are in rural areas. So again, I wouldn't say start a business for that specific purpose. However, make sure you're inclusive of clients that are in rural areas.
The other thing that you said that I really loved is the fact that it sounds like you don't hire until you actually have the patient. So what amount of time do you have in between when you get the patient and you have to find somebody to be able to fill that? Because that sounds a little nerve-wracking.
I've learned my lesson hiring nurses too early. Nurses have a very unique career position. They have the opportunity to work in hospitals, in jails, in schools, in plenty of places, nursing care facilities. Like, just because one nurse takes care of children or pediatrics in the hospital, she may also have experience where she can go work in a nursing home as well because she's taking care of seniors. So nurses move, and they move quickly. Hiring a nurse and keeping her on hold until a child gets out of the hospital just does not work. She's not going to sit around and wait until your client gets discharged. And discharge dates change and move all the time. So I try to hire as close as I can to that child coming home, or as close as I can to my approval. If I've put in an application for services, the state of Georgia has a 30-day approval process. That's when I'm starting to look for a nurse. That's when I'm starting to, because I know the location. I've already discussed with the parents what type of hours they're going to be looking for. I know the client's needs because my RN has already gone in and done the assessment. Hiring nurses and keeping them on the back burner for work just doesn't work. Now, I keep their information. I make sure they have my information. I have a number of nurses that have gone on to different jobs, gone on to different careers, and have come back and, hey, checked in. Hey, do you have any work? I keep their information. I make sure they have a line of contact for me. But especially if I'm going to hire for a rural area, I'm gathering information, but I'm not putting anything in stone and bringing anybody on board. Definitely not promising them any hours or things like that until I have complete confirmation. Now, Using social media as a tool can be very helpful in pediatric home health care. There are a lot of parents that are in social groups, that are in talks and having conversations about their child and about resources. Many of my clients have come for referrals. So you have to be able to use social media not just as a marketing tool, but a social tool. Join the groups, have conversation. Soliciting in the groups is very much frowned upon. However, if you're in the group and you're watching and you're providing information, maybe you're not in the group soliciting and trying to sell services, but you're in the group providing information. For example, say you join a parent group and you make a post telling parents that you can get paid for being your child's caregiver. You send an article saying that the state of Georgia has now approved parent pay. That's providing information. You don't have to tack on a sales pitch. You don't have to do any of that. You posting from your business page lets them know. They're going to go seek out this resource and seek out the person that's provided this information. And that way you can let them come to you. Join the groups and provide as much information because these parents are seeking this type of information. Soliciting is not what you should be doing in these groups. Providing information and resources to parents is what you should be doing. And if you can do that effectively, the clients will come.
Okay, so this sounds like a lot of work. I'm not going to lie. How much time are you spending in these groups? Because this day and age, there's a group for everything. How much time are you dedicating to that? Or, I mean, at this point, you $1 million business. But in the beginning, what would you say, like, how's that impacting that? And how much of this do you plan on utilizing as part of your strategy to grow going forward?
In the beginning, I did a lot of this. That's how I learned about not soliciting in groups. That's how I realized groups were basically not even approving you if they thought you were going to be in the group soliciting. What I actually did was more watching, more listening, watching conversations with people, seeing people ask questions and comments. And if I knew the answer, I'd post a response. I did a lot of this early on. I didn't necessarily get clients from it because, again, most of my clients came for referrals, but I made a lot of connections from it. And I've had clients from out of state ask me questions that would have signed up, but since I'm only registered in the state of Georgia, I couldn't provide them services. However, moving forward, I will not be the one doing this. My plan is to hire a social media content, social media marketer to do these types of things for me. But now I can give her the blueprint of what I've seen work and what I need her to do and just get her to manage what groups are the best types of groups to join and things like that. I'm not looking to do that type of work myself anymore because I'm a little bit too busy. But hiring someone to handle those types of things and speak on your company's behalf. And again, just training them not to be the solicitor or the salesman, but to be the person that's providing information and resources in the comments is what's going to be helpful. The next topic I want to discuss is partnering. One thing I did when I was in senior home care is I partnered with senior centers. I partnered with the community college, churches, things like that are what's going to get your name and your business out there. Let me explain what I mean. So we did Meals on Wheels. We had our car wrapped and we signed up to deliver Meals on Wheels to seniors in the North Georgia area. It was a very eye-opening experience. I'm very glad we did it, actually. It allowed us to meet a lot of seniors in their home. It allowed us to provide them resources as well. Another thing we did is we came up with a painting activity. And we went around to all the local senior centers in the North Georgia area. And we asked, could we come in on a specific day and just paint with the seniors? So we created canvases with templates. We brought in the paints and the seniors loved it. Think about it. We're driving up in our wrapped car. We're walking in our company shirts. And we're providing fun and laughter and activities to these seniors that come to these senior centers and then have to go home alone and may or may not have the care of the services that they need. And we were able to get clients from that. So when I say partner with facilities, Partner with those facilities that provide those type of services, that provide services that you may or may not provide, and provide something to their clients besides home care. Provide fun, provide activities, provide resources. You can't always go in with the sale attitude. You just sometimes have to go in as a person that has the information or has other sources of help. And then those people will come to rely on you and trust you and then contact you for your services.
So what if I've never done this before? Like if I'm wanting to work with the youth and I have no experience like at all. And I'm showing up at this facility like I am here and I started this thing. Here's my business card. And they're like, are they going to ask like, who have you worked with? What have you done? Or are they just like happy to have support? Because like, how does this work?
I had never done it before. We looked up all of the senior centers in North Georgia, and we first sent an email to ask, can we stop by and can we have a meeting? To all of them responded actually, and they all gave us a date and time when we could come in. We went in and we pitched ideas. Hey, what do you guys do here for the seniors? What do you need? What types of things do you think would be uplifting for them? We have some ideas, but can you tell us what you need and what you're looking for? Many of them said, oh, we already have activities. We already have things. That wasn't the moment I just walked out and said, okay, thank you. Have a good day. It was, well, maybe we can provide something more. Do you have a certain hour of space that they're not doing anything? Maybe we can just come through. And I remember on Mother's Day, we stopped by and we brought flowers for all the seniors. I remember on Valentine's Day, we bought Valentine's candy and we got the kids to put cards on them and we just dropped them off. And those cards had our logo on them. So sometimes they don't always know exactly what they need, but they're always receptive to someone coming in and providing some type of help, some type of uplifting resource. So don't be afraid. If you're afraid to just walk in and knock on the door, send an email, make a phone call, and just ask, hey, do you have time for me to come in so we can have a conversation about what we can offer? We do provide home health care service, but we also want to be a resource to your clients outside of that. We want to be able just to bring happiness and joy in the lives of these people when they're outside of the home or when they might need other assistance. So again, knocking on the door, sometimes it depends on the facility. But if you're nervous about that, send an email or make a phone call and let them know who you are. That works as well. Finally, offering free care eligibility checks for clients can be helpful. There's a lot of people out here that don't know if they qualify for the service. There are a lot of people out here that don't even know about the services. So putting yourself out there and saying, hey, we offer free eligibility checks. We can come in, we can talk to you about the services just to see if you might qualify, is a way just to provide the people the information they might need and let them know the government has a program out here that can help you. And I am a service provider of the government, and I just want to come in and see if there's a way I can help you. You can go to schools, you can go to local events or outside events, set up booths, things like that, just to provide information and resources. The key word here for this episode is information and resources. You're not just trying to make sales here. You want to become the reputable, the provider. You want to become the resource of information as well. And then people will look to you for your services.
So what I heard you say is that in essence, I have the ability to help people apply for Medicaid to see if they can, in essence, pay for my services. Is there a certification I need for the state in order to do that? Or is that one of those things that anybody can just help them apply? Like, can I hire people and just send them to conferences and places all over the world and just have them register people tomorrow?
So I did an episode on how to become a home health care service provider. Please watch that episode because I gave you the steps you need in order to get certified by the state to become a Medicaid provider. What you're going to need to do is I was the person doing these things, but moving forward, I won't be. However, what I am going to do is hire someone and train them on what they need to do. That person just needs to be your employee. That person just needs to work for the company. They need to understand the process and they need to understand the paperwork. Once you provide them those resources and they understand how to explain these services to clients and what paperwork needs to be filled out, that's all you need to do. They will go into the home or they will have the conversation with the parent and have them fill out this paperwork. My RN, my nurse, she's the one that's going to go in and do the clinical assessment, and that will be scheduled. That's outside of the purview of the person that's just going to be helping them fill out the application. And you make that clear to the family. The eligibility checks are just to get the application process started and to provide the information to the family. Help them understand what the services are and what they may or may not qualify for. You never promise a family hours. You never promise them acceptance into the program. You're just providing them information. And from there, the nurse will go in and make her evaluation, and we will put in the packet to the state and let them know if they've been accepted into the program. So I've given you a lot of information here, a lot of resources that I've used in the past, and I am now about to start using in the future to continue to grow my business. I had a little pause in my business, but now that I'm in remission, I'm going to start growing this past just $1 million business into a multi-million-dollar business. So I want to keep sharing my journey with you guys. I hope these tips were helpful, and I'm going to have more and more resources on my website that you can use to grow your home healthcare business as well. Thank you.